How to get rid of acne on the chest. Well, hey guys, chest acne is frustrating to cope with. It can be triggered by, aggravated by most of the same underlying issues that contribute to facial acne. For example, your hormones play a big role in triggers, and your genetics, how they influence the oil production in the sebaceous oil gland, as well as the turnover of the cells lining the pore. Treating acne early is important not only to clear it up, but also to prevent scarring. And the nature of the skin on your chest is such that it is a lot more vulnerable to the formation of raised and thickened scars. People of African descent are more likely to form thickened scars in a type of thickened scar called a keloid. So treating the acne can help keep that from happening by preventing the scarring from happening. Also, people who have a deeper skin tone are more likely to deal with acne that heals with stubborn hyperpigmentation. Yet another reason to be on top of the acne treatment. But there are some things that you can do, some lifestyle adaptations that will help in clearing up your chest acne. Chest acne can be aggravated by friction on the skin. It causes irritation that leads to more inflammation and can aggravate breakouts. So stick to loose-fitting fabrics. Sports bras, especially if you're working out in them and then you're not changing out of them, they can really be a contributing factor because they're up close to the skin and they trap sweat there. That can lead to more stubborn breakouts. So in addition to wearing loose-fitting, comfortable clothing, make sure you change out of sweaty clothing. Sweat left behind on the skin is irritating, and that irritation can further aggravate the acne. So when you're done exercising, try and take a shower to rinse the skin of sweat, which could irritate your skin otherwise.
Hypochlorous acid sprays, I find, can be pretty helpful in those situations where you can't necessarily jump in the shower right away after a workout to rinse the skin of sweat. Hypochlorous acid is made by our immune system to fight off infections. It's anti-inflammatory and antimicrobial, and I find it very helpful not only for cutting down on sweat-induced irritation in the skin, but also for deodorizing because it cuts down on the bacteria that break down your sweat and lead to body odor. It's generally well tolerated, although it can be a little bit drying. I'm not sponsored by this company. I buy this on Amazon. This is just the one that I use and recommend. It does say face, but you can use that on the body.
When it comes to bathing, choose a body wash with an active acne treatment, such as benzoyl peroxide, salicylic acid. These ingredients can be effective in a wash form. Lather the wash of your choice to the chest and any other body site where you deal with acne breakouts. Let the lather sit on the skin for a few minutes before rinsing it off. Now, when it comes to leave-on acne treatments, that's certainly an option as well. You may reach for those things. Leave-on benzoyl peroxide, for example, helps to reduce the burden of the acne-causing bacteria, Cutibacterium acne, and it also helps to prevent breakouts in the future. However, be aware of the fact that leaving it on the skin will bleach your clothing. So that's why I tend to prefer recommending a wash. The shorter contact is still an effective therapeutic modality, but with fewer side effects of dryness, irritation, and you don't have to worry about bleaching your clothing. Speaking of treatments that you leave on the skin, one of the go-to acne treatments is a retinoid, a form of topical vitamin A that not only can help in controlling the breakouts, it can help with normalizing the pore lining turnover so you don't get closed and open comedones. Now, you can buy an FDA-approved retinoid for the treatment of acne over the counter without a prescription, adapalene. Adapalene can be very effective for acne, but on the chest, it may be a little less effective. So you may find that you try it out and it doesn't quite work out for you. That's not uncommon. It works for some people on the chest and body, but not for others. Now, alternatively, of course, see a dermatologist. A prescription retinoid may be better suited for your type of chest acne. For example, one of the newer prescription retinoids that we have nowadays is trifarotene. This is a retinoid that is specifically FDA approved to be used not only on the face, but on the trunk. It is the first prescription retinoid that is FDA approved for acne on the trunk. And one of the advantages of this prescription retinoid is that it is a lot more selective in terms of the receptors that it binds to. The formulation has a much lower percentage of retinoid needed to achieve the desired outcome of acne control. So that might be a better option for you. And it tends to be less irritating than tretinoin, probably because it is a lot more selective in terms of the receptor that it binds to. If you want more information on this, check out my video on trifarotene. I talk more about it there. All right, so those are some active acne treatments that can help in clearing up and preventing the chest breakouts. The other thing, if I didn't already mention, is do not pick. It can be very challenging to resist the urge to pick at pimples on your chest. You may do it subconsciously. Lean into a hydrocolloid patch, serves as a barrier, keeping your fingers away. Picking is problematic because it prevents the acne from healing, makes the acne resistant to the treatments, and it also puts you at risk for infection, scarring, and post-inflammatory hyperpigmentation. In addition to helping prevent you from accessing the pimples, hydrocolloid patches are advantageous because in the case where you have a pimple with quite a bit of pustular content, inflammatory exudate, it can help draw some of that out and flatten the pimple, facilitating healing. Don't neglect moisturizers. That is something that a lot of people with acne are fearful. They approach moisturizers with some trepidation out of concern that they're going to clog their pores. But moisturizers actually end up being really useful for acne because they address the skin barrier. People with acne typically have an impaired skin barrier. They're more prone to losing water from the skin and developing irritation, which ultimately worsens the acne. Because moisturizers that feel greasy may not be comfortable to those with acne due to the oily nature of the skin of people with acne, I can suggest some moisturizers that tend to feel more lightweight, have hydrating ingredients, and ingredients that support the barrier, such as ceramides. When choosing a moisturizer, I also suggest considering a moisturizer that has niacinamide. Niacinamide is an ingredient that is an antioxidant, it's anti-inflammatory, it can help with redness, inflammation. It also helps cut down on and help clear out hyperpigmentation. And it's been shown specifically to be beneficial for acne. So I will list down below in the description box some moisturizers that are more hydrating, more lightweight, don't feel as greasy. The other thing to take into account if you're someone who has long hair is the hair care products that you are using. Is your hair coming in contact with like this part of your chest? Is that where you're getting the breakouts? Because a few things may be going on. First of all, any leave-on styling products that you have, they may actually be contributing to the acne. Certain thickeners and conditioning agents and hair care products, oils used in styling products have been associated with acne breakouts. It's called pomade acne. So if you do have longer hair, try and keep your hair up off of your chest. You know, if you've got long hair and you let it hang in the front. Also, certain ingredients in shampoos and conditioners especially have been shown to stay behind on the skin, and this is thought to perhaps, not proven, but perhaps play a role in acne breakouts on the chest and back. So when you're shampooing your hair, you're conditioning your hair, make sure you rinse all that stuff out before you come in with your body washes and or your acne wash of choice. It will help remove that potential residue and reduce the potential for those things to further aggravate your acne. Understand that certain medications, dietary supplements, can actually be a culprit in acne breakouts on the chest and back. Specifically, testosterone drives more oil production, leads to breakouts. Anabolic steroids that people may be pursuing for muscle purposes, or what are called selective androgen receptor modulators, or SARMs. These are also substances that are used by bodybuilders, people looking to put on muscle. These can all impact the sebaceous oil gland and lead to pretty inflammatory acne that has a predilection for the chest, the back, as well as the face. And it can be quite inflammatory, quite cystic, and it can certainly leave you scarred. High doses of iodine can also cause acne breakouts. Certain B vitamins are associated with acne breakouts. There is some association with the consumption of whey protein and more stubborn acne breakouts, although that has not necessarily always been reproducible. It's also thought that people who consume a lot of skim milk may have a tendency towards more stubborn acne, although again, that is another one of those, is it guilty by association? Harder to reproduce, more research is needed, but I do tell people that if they want to try cutting out skim milk in favor of full fat dairy, or choosing not to consume dairy, it's up to you, trying that out, seeing if it makes a difference, because it is a relatively easy thing to do, and if it doesn't make a difference, then clearly it was not the culprit for you. So all that to say, you will hear a lot of people on the internet tell you, oh, cut out dairy, cut out dairy. You don't necessarily have to cut out all dairy, but you might consider a trial of going away from skim milk in favor of either full fat dairy, or again, maybe not drinking so much milk. Just know that that association is not that robust. Same with whey protein supplements, which is a milk-derived ingredient. The issue with the whey protein association is always like, well, were these people in these studies also on things like anabolic steroids that maybe push them over the edge to more stubborn acne? So more research is needed in that regard. I do have a video all about supplements that cause breakouts, so I want you to watch that one if you are dealing with breakouts on the chest or the face or anywhere in general, so that you have an understanding of how to tell if the supplements you are taking are playing a role. The acne manifestation is a little bit unique. I think that video will be of use to you. So I'm going to link it on the end slate. But that about wraps this one up in terms of my tips and tricks for how to get rid of acne on your chest. I really hope this video was helpful to you. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.